I think it's really important for you to be happy on a daily basis. After all, you want to enjoy your life. But did you know that if you have a happy life with low stress level and low anxiety, you will live longer, and that your brain will be sharper, and that your heart will be stronger? So I have a very specific recipe on how to help my patients reduce their stress and anxiety levels and have a happier life. So my general approach is to put patients in three categories. If you are someone who has some level of anxiety and you don't have time, you're stressed all the time, you're category one. If you're someone who has a lot of anxiety and always feels that she is or he is running around all the time and has some conflicts at work, at home, that's second category. And there's a third category. If you have a lot of depression and feel like life is not worth living, or if you have panic attacks, that's the third category. So if you're in category one, here's what I'd like you to do. Number one, you need to reduce your responsibilities. Your first reaction may be, but I can't. I have to take care of the kids. I have to take care of my job. I have to deal with my spouse. I have to take care of my family. True, but there are some things that you can reduce in terms of your level of responsibilities. You can't keep doing everything and be happy at the same time. Some things need to go. You need to exercise about 3 hours a week, and you need to set aside 10 to 15 minutes a day to meditate. Breathing slowly with a count of 6 to breathe in, with a count of 6 to hold your breath, but with the count of 6 to breathe out can do wonders for your brain and for your heart and for your ability to make better decisions so you're not always stressed out. Sometimes one good decision can open up a lot of free time for you. But if you're always running around, you will not make that good decision. If you're in the second category, if you are someone who has a lot of anxiety, if you're someone who has conflicts with people at work, you need to do everything I just said. You need to reduce your responsibilities. You need to definitely set aside some time for exercise, and you need to meditate. But you also need to receive something called cognitive behavior therapy. CBT can do wonders for your brain because as you talk with a therapist, you define what are your goals for the future, what are the things that are important for you, how can you view other people's behaviors and how they interact with you. After all, if you want to be happy, you need to make people around you happy. But how can you make them happy if you're irritable and you're angry with them to begin with? So you need to receive therapy. This is not something you can do on your own. And cognitive behavior therapy does not have to go on for years and years. Sometimes receiving 10 sessions or 20 sessions of CBT over a 3 to 6 month period can help you a lot. We provided this program and we help many of our patients with cognitive behavior therapy and their lives turned around. If you're in the third category, you need to see a psychiatrist. If you have frequent panic attacks, if you think life is not worth living, if you cannot sleep at night, if you feel overwhelmed with your anxiety and or your depression, you need professional help. I'm against medications most of the time, but for patients like you, I do prescribe medications like Zoloft or Lexapro because your brain chemistry needs to be optimized. And people like you may have several family members who have similar symptoms, and they may have passed on some genes that make you more prone to anxiety or depression. Again, if someone is in ICU, they need medications, and just talking to them will not be good enough. And if you're in that category, I do recommend that you see a psychiatrist. In addition to exercising more, meditating, and receiving cognitive behavioral therapy. The point that most patients don't appreciate is these things are treatable and fixable. Just because you've had anxiety or depression or stressful life for decades, it doesn't mean you need to continue to be like that. You need to hit the pause button and ask yourself, what is the main thing in my life? What is it that I find meaning in? What are the values in my life? And also ask yourself, what are your goals for 20 years from now or 10 years from now, and then decide what you're going to do in the next 90 days. Once you have that kind of vision, you'll be more clear as to what are your priorities and what you need to do to achieve your specific goals and be in line with your purpose in life. Remember, if you're not happy in your life, you are responsible for it. And if you do take your steps, if you take a few steps to change things in your life, you will be able to enjoy your life on a daily basis. You will be able to reduce your stress, and you will be able to laugh more frequently and enjoy the life you have. Try it.